about
louder.
intro universal health coverage. Achieving UHC is key to Sustainable Development Goal 3, ensuring that everyone receives essential health service without financial hardship. UHC includes comprehensive coverage, equitable access, and financial protection. It improves health outcomes, reduces poverty, enhances social cohesion, and boosts economic growth. Addressing challenges like inadequate funding and weak health system requires increased public financing, stronger primary care, and global cooperation, as emphasized by USC Day and WHO initiative.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Nazim. Today I will talk about ways to achieve universal health coverage. If we talk about universal coverage, there are 5 ways to achieve universal coverage. First one is health financial reforms, service delivery improvements, health informative systems, regulatory and policy reforms, and community engagement empowerments. So the first one is health financial reforms. So basically, the health financial reforms, like the government can provide more money for healthcare through taxes or other methods. So make sure essential healthcare is affordable for everyone. So the second one is service delivery improvement. Investing in basic healthcare like checkup and treating common illness is important to make sure everyone can get the healthcare where they like. Training and sending more healthcare workers like a nurse, doctors to the place that are not enough. And also building and improving hospitals means healthcare in all crucial areas to make sure that everyone can easily access to the healthcare. So the third one is health information systems. Setting up strong systems to collect and use health data, make a better decision and check progress towards healthcare goals. Using a technology like electronic records and telemedicine can improve how healthcare is given, especially those who find it hard to reach the healthcare access. So another important point is regulatory and policy reforms. So making the rules and standard to ensure healthcare is good quality, safe, and also honest is very important. Creating a policy that focuses on making sure everyone can get healthcare, addressing unfair differences in health, and make sure everyone gets the same chance to being healthy. The last point is community engagement and empowerment. So getting communities involved in planning, doing and checking healthcare programs help make sure they shoot everyone needs. Also teaching people about health and how to make a good choice for themselves, and the community empowers them to take care of their health much more better.
So even the USC have their own problems and challenges. So what are the challenges? It is limited community participation and empowerment. Despite having the effort to involve in communities in healthcare, many of the universal healthcare systems struggle in engaged communities in implementation and evaluation of healthcare services. So, lack of awareness and insufficient supplies may contribute to the barrier that hinder the community to participate. So the other challenges that USC face is a consistent political commitment and leadership. Healthcare necessitates political roles and leadership to recognize healthcare as fundamental rights and willing to give the resources that is needed. But then the political priorities change over time, which may result in increasing authority in funding and policy support. So this may result in delay and make it harder for the vulnerable people to get the healthcare needed. So the last challenges that USC face is persistent health disparities and inequalities. Despite having the effort in achieving the UHS, some of the population group, for example like ethnic groups, indigenous people, immigrants, or even rural residents, may have trouble in accessing the healthcare system. So this is due to some factors, for example like socio-economic status, differences in language and cultural, or even lack of education in healthcare. So this will result in uneven health outcomes.
Hi, my name is
Muhammad Ali bin Masuki, and now I will talk about the solution for challenges of UHC. Every obstacle has their own solution, so there are several solutions and actions that can contribute to the attainment of the UHC. But in this video, I will talk about 3 solutions for the challenges of the UHC, which are community engagement, political commitment, and addressing health inequalities. So, community engagement can enable individuals to have an action role in decision-making process that relate to the healthcare. For example situation, community health promotion program can fortify health system and encourage the objective of UHC. However, government and policymakers must demonstrate a strong political will and prioritize UHC as a fundamental goal of healthcare system. Last but not least, targeted interventions are required to address health obstacles to receiving healthcare services. This can minimizing the regional inequalities and make sure everyone has fair access to healthcare.
Universal healthcare has the potential to positively affect people's lives. How does it do this? Firstly, it reduces financial burden, or in simple words, reduces the cost of healthcare. It does this by reducing the amount of out-of-pocket payments, which are payments that you make with your own money, as well as the pooling of risk, which involve the pooling of financial resources from a broad base of contributors. Next, by providing access to preventive services and early diagnosis, UHC can improve overall health outcomes as well as reduce mortality rates within a population. UHC also includes coverage for preventive services such as vaccinations, screenings, and health education programs to prevent costly medical conditions from developing or progressing, thereby reducing the need for expensive treatments in the future. UHC promotes cost-effective care. It prioritizes cost-effective interventions and treatments based on evidence-based medicine. By focusing on interventions that provide the greatest health benefits for the lowest cost, UHC helps to optimize healthcare spending and reduce unnecessary expenses for both the hospital and the patient.
There are multiple benefits that we can get from universal health coverage. However, we should also consider the cons that come with it. The first con is the fact that there would be longer waiting times. So, since most hospitals will be overstaffed, probably due to the unexpected amount of patients, the waiting times will increase. This may cause medical mishaps that could possibly endanger an individual's life. This could especially be seen during COVID-19 pandemic in 2020, where there was a overflow of patients. However, most hospitals were understaffed, so the mortality rate increased. As shown in these statistics here taken in Malaysia, February 2021, it would take up to 13.88 hours from getting swab test up to the point of getting the results of the swab test. Secondly, there would be a reduced quality of care. Certain countries that provide universal health coverage would sometimes restrict their resources and also funds available for universal health coverage in order to control the cost. This will definitely directly affect patients' well-being and health because they will not be able to get the proper medical treatment needed. Furthermore, it will also cause inequality between patients that have a stronger financial background that will be able to cover those costs, so they will get proper treatment. However, those patients that don't have better financial background, they would not get proper treatment. The last point is personal responsibility. UHC may reduce an individual's personal responsibility for their own health. Since the government is going to cover all the healthcare costs, healthcare treatment, and medicines that's required by the patient, certain individuals may take advantage of this by trying to get claims for health problems that they have never experienced. Therefore, less incentives should be given as a preventive measure for these kind of individuals so that they would avoid from doing so.
UHC, which is a short form for Universal Health Coverage, is a critical aspect of public health and worldwide healthcare system. There are several reasons why we should be concerned about using or achieving UHC. Firstly, equity and social justice are fundamental pillars of UHC. This ensures that everyone, regardless of their socio-economic status, can access essential healthcare services without facing financial hardship. Malaysia implement UHC through programs like NHFS, which is known as National Health Financing Scheme. This program ensures that all the citizens has equal access to essential healthcare service, regardless of their income level. This program also ensures that even the most vulnerable population can access essential medical treatment without facing financial hardship. Moreover, UHC plays a crucial role in enhancing health security, particularly during the times of epidemic, pandemic, and other health emergencies. To make sure the health system works more effectively, UHC ensures the access to essential healthcare services when they are needed the most. This eventually protects the individual and communities from the health impact. The role of UHC in enhancing health security demonstrates during the COVID-19 pandemic. For instance, Malaysia implement individual testing and contact tracing measures to isolate and identify the cases promptly. This helped prevent the COVID-19 virus from spreading among the community. Lastly, achieving UHC aligns with global health goals, especially SDG3, which is good health and well-being. It addresses health inequality and ensures equitable access to healthcare worldwide. It also emphasizes improved health outcomes and leaving no one behind in pursuit of well-being. There are some projects implemented by Malaysia to promote global health goals. The first one is One Malaysia Clinic, which provides basic healthcare services to underserved population and low-income individuals. The second project is launched in 2009, which is the Health Transformation Program. This Health Transformation Program aims to improve the effectiveness and efficiency of Malaysia's healthcare system.
Guys, I'm Sri. Today I'm going to talk about solution and actions that can contribute to the aim of UHC, which is community engagement. Communities must be included. People must be given the opportunity to actively participate in the process that determine their health and medical treatment. Promoting health literacy, community health promotion, innovative and participatory approaches can strengthen health systems and foster a sense of ownership over UHC goals. Other than that, political commitment. UHC must be given top priority by government and legislators in order for them to be a core objective of their healthcare system. This entails setting aside enough funds, passing legislation that is helpful, and putting in place an efficient government framework. Lastly, addressing health inequalities. In order to address health disparities and barriers to healthcare access, targeted interventions are necessary, especially for disadvantaged and vulnerable populations. This means addressing the socio-economic factor that influence health, reducing regional disparities, and making sure that everyone has equitable access to medical treatment. We have to do some awareness activities that we have to increase the UHC, which is we can celebrate International Universal Health Coverage on December 12th, Health Literacy Program, which is Community Health Literacy Workshop, and lastly, partnership with civil organizations.